Hello, welcome to part two of psychological disorders. In this video, we're going to talk about anxiety disorders like phobias and obsessive compulsive disorder. There is a part one of psychological disorders you should watch. There is a part three you should watch. This is part two. All right, let's start out with a joke. Here's one. How many counseling psychologists does it take to change a light bulb? Just one, as long as the light bulb wants to change itself. Get it? Because when you go to therapy, the therapist can't change you. You have to want to change yourself. So that's the joke part. All right. Okay, let's see. What are we going to do? Psychological disorders. Let me pull this slideshow up. Here's what we're going to look at in this show. Generalized anxiety disorders, panic disorders, phobias, obsessive compulsive disorder, and PTSD, post-traumatic stress disorder. First of all, phobias. What do people have phobias about? Well, here are some common ones. Being alone, closed spaces, heights, animals. You can see the people who have a fear is the blue bar, and the greenish bar is when it's a phobia. So lots of people have fears of different things, but a very small percentage of the population actually does it rise to the point of being a phobia where it interferes with your life in some way. What are the different kinds of phobias? Agoraphobia, acrophobia, fear of heights, claustrophobia, fear of closed spaces, and hemophobia, phobia of blood. So people wonder, why do we have phobias? And some people think that maybe there's an evolutionary reason, there's a natural selection thing going on, that for hundreds of thousands of years, humans are out foraging, hunting, and gathering, and it would be useful to have a fear of heights. It would be useful to have a fear of snakes, a fear of spiders, so that having these fears helped us survive. And that now some people take those fears which were once good to have, and in some people it becomes extreme to where it's harmful. So that's a theory of phobias. Kind of a natural selection or an evolutionary perspective there. Okay, what's next? Generalized anxiety disorder. Anxiety is fear and nervousness. So if it's generalized, it means you kind of have it all the time for lots of different things. A phobia is a very specific fear. Generalized is the opposite of that. You have the fear all the time. So it's persistent and uncontrollable tenseness and apprehension. And you're aroused. Your autonomic system is aroused. You're on edge. You're breathing heavy. Your blood pressure's higher. That sort of stuff. And sometimes you can't identify or avoid the cause of the feelings. You don't know what's causing the anxiety. Okay, there's another type of anxiety disorder called panic disorder. Generalized anxiety, you have it often throughout the day, day after day. Panic disorder is when you have minutes-long episodes of intense dread. Could be feelings of terror, chest pains, choking, or other frightening sensations. So if you have panic disorder and you have a panic attack, you could be sitting in class and you could have memories of something bad that happened to you, or you could be worried about something and you could have the panic attack in class. You could have it while you're driving. You could have it while you're home, right before bed. But it's this intense sense of dread. Anxiety is a component of both panic disorders and generalized anxiety disorder, but it's just more intense in panic disorder. A lot of times people who have panic disorder, if there's something that triggers the panic attack, they'll start to avoid that place or those people, whatever the trigger is. Okay, another anxiety disorder is obsessive compulsive disorder. This is the persistent unwanted thoughts and urges to engage in senseless rituals that cause distress. So an unwanted thought would be, like in this chart, It says concerned about germs, dirts, or toxins. So an unwanted thought is, I've got germs on my hands, I've got germs on my hands, I've got germs on my hands. And the compulsion would be down here, excessive hand washing. So you're constantly washing your hands, using hand gel, not touching dirty things like doorknobs. Um, so obsessive means a thought that's repetitive. Compulsive means an action that's repetitive. So it's thoughts and actions that are repetitive. Um, that's obsessive compulsive disorder. And you can see which one's the most. Hand washing is really high down here, 85%. I don't know if you can see the numbers. Of people who have OCD, 85% engage in hand washing, 51% repeated rituals in and out of a door, up and down from a chair, and 46% checking doors, locks, appliances, car brakes, or homework. So those are the sorts of things that's OCD. Okay, so some people again ask about OCD and why does it happen, and there's this theory that it involves classical conditioning. If you remember classical conditioning with like Pavlov experiment or Baby Albert, you pair two things together, and whatever's going on for one, the reaction to one rubs off on the action of the other. Like Baby Albert learning to fear the white rat. So the idea is that fears can be classically conditioned, and those fears can generalize, like Baby Albert. He feared the white rat, and then he started to fear other white furry things. And then what happens with the compulsion, again, this is a theory, is that if you're experiencing the anxiety, washing your hands, or whatever the compulsion is, would relieve the anxiety. So then the next time it happens again, you wash your hands again because washing the hands worked last time. It made you feel better. So you develop this new habit of hand washing precisely because it makes you feel better. And that's negative reinforcement. If you recall, negative reinforcement was when there's some annoying stimuli, you take some action and the annoying stimuli is gone. So that's going on maybe with OCD. Okay, what about post-traumatic stress disorder? 4 or more weeks of the following symptoms: haunting memories, nightmares, social withdrawal, jumping anxiety, and sleep problems. People with PTSD have often been in very traumatic situations. Like this picture is soldiers in combat. It could be firefighters that see death and suffering on a regular basis. Could be other people that see traumatic things a lot. And so these symptoms, you could be out of combat. If you fought in Iraq, you're back in the US, you're doing your job, but these symptoms could haunt you at night. They could pop up in the middle of the day. You could have these symptoms, and so that would be PTSD. A lot of people who experience trauma never get PTSD. Only about 10% of women do, and 20% of men develop PTSD. In fact, with Holocaust survivors, there was a remarkable sense of resilience against traumatic situations. So just because you experience trauma doesn't mean you develop PTSD. Okay, Freud had a theory about anxiety disorders. He thought that we repress our painful thoughts and feelings, and that when we take it out of our conscious mind and push it down into our unconscious mind, it's down there bubbling up and causing us problems, and that's causing us anxiety. That's why we have the defense mechanisms, for instance. The learning perspective, one idea is that you can learn anxiety through observational learning. So there's been research, for instance, on young monkeys, watching some monkeys who have no fear of snakes. They watch other monkeys that have a fear, and then they learn to be fearful of snakes. I already talked through this fear conditioning idea. Okay, so that is the end of the anxiety disorders. Remember, there is a part 3 to the psychological disorders video series. So thanks for tuning in, and see me in class if you have any questions.